Hello, thank you for joining us. I'm Tanita Cheatham with the Detroit Medical Center, and today we're going to talk about bariatric surgery. We will cover topics such as health conditions related to obesity, working with a bariatric surgeon, the criteria for surgery, surgical safety, and the bariatric program at the Detroit Medical Center. Joining me in this conversation is Dr. Amy Somerset, a bariatric surgeon at the Detroit Medical Center. Dr. Somerset, thank you for being with us today.
Thank you for having me.
Are the health conditions related to obesity something to be concerned about here in metropolitan Detroit?
Definitely. First off, about 38% of Detroit is considered obese. So what that means is 1 in 3 people has a chronic disease. Obesity is a chronic disease that leads to many health conditions. Some of them I'm sure you realize, and some of them you probably don't.
What are some of those health conditions?
Definitely liver disease, heart disease, stroke, diabetes, high blood pressure, sleep apnea, but things that you may not realize are infertility, migraines, asthma, many other conditions, and actually cancers. So many types of cancers are associated with obesity. And especially now with COVID, obesity is very important. We know that patients with obesity are much more likely to be hospitalized, much more likely to be on the ventilator, and much more likely to die. So with COVID in Metro Detroit, now is the time to treat obesity as effectively as possible.
Can bariatric surgery and the resulting weight loss help to alleviate these medical conditions?
Definitely, definitely. When you lose weight with bariatric surgery, you cut your cancer risk in half. Many conditions like heart disease, liver disease, stroke, diabetes, sleep apnea, infertility, migraines, depression, many of those conditions can go completely away or at the very least be significantly improved. So if you were taking a pill, maybe you're not taking a pill anymore. Another really important thing is just being active in your life. And I have so many patients that they have knee pain, they have hip pain, they can't move, they can't bend. After bariatric surgery, they have that ability. Not only are they playing with their kids and running up the stairs and able to do it, but they actually want to do it after surgery. And that's really great to see.
You know, you talked about exercise and being healthy. You know, a lot of people do that. They exercise, they try to eat right, but at some point for some people or many people, it just doesn't work for them.
Very true. And I'm glad that you said many people. I would say most people. Most people cannot lose enough weight to get out of the obese category with diet and exercise. It's just the reality. I think if you ask anyone that's tried to lose weight, they can tell you how hard it is. I always quote 5%, actually less than 5%. Less than 5% of people who are obese are able to lose meaningful weight and keep it off, right? Because it's difficult to keep it off with diet and exercise alone. So that's where bariatric surgery is a very important tool, and you should speak to your bariatric surgeon if you are having difficulty keeping that weight off, which most people do.
At what point should a person consider consulting a bariatric expert?
I think every person should calculate their own BMI. It's really easy to calculate your BMI. The BMI is body mass index. It's just a number that tells you how much fat you have on your body for how tall you are. It's really important because it tells you your level of obesity. Are you overweight? Are you obese? Or are you severely obese? If your BMI is over 40, that is severe obesity. My opinion, if you are at that threshold, it's at least worth talking to a bariatric surgeon because we know it's so difficult to get that weight off and keep it off to a healthy level. If you're somebody that has been struggling with weight loss, if you're somebody that is motivated and wants to lose the weight and wants to be healthy, and certainly if you're somebody that has those conditions associated with obesity, like high blood pressure, like diabetes, like sleep apnea, it is definitely worth talking to a bariatric surgeon.
What might make some people hesitant is the misconception that bariatric surgery is not safe. Can we talk about the safety of bariatric surgery and the safety measures in place at the Detroit Medical Center to ensure that our patients stay safe?
Bariatric surgery is extremely safe. I'm glad you bring this up because I do have patients coming telling me that they're concerned about safety. They've heard bad stories. That's simply not true. Bariatric surgery is very, very safe. It's as safe as getting your gallbladder out, and we take gallbladders out every day, all day. It's actually got a lower mortality rate than getting your knee replaced. We use minimally invasive techniques, so we're using little cuts that makes it even safer. So a very, very safe operation. The DMC has a really good safety profile for patients as well. The program goes through a rigorous evaluation consistently to achieve certain accreditations, and those accreditations are a testament to great patient outcomes and great patient safety. So I think every patient should be aware of what programs have those accreditations.
You know, another misconception could be that if I visit a bariatric surgeon, I have one appointment and then the next thing is surgery. And that's a myth too. This process is a journey. Can we speak to that?
Exactly, it is a journey. I think a lot of people are scared to meet with the surgeon. I think a lot of people maybe aren't ready, and I do think they feel that they're going to have surgery right away, and that's simply not true. It is a process, it's a journey like you said. So you're meeting with the dietitian, you're learning good behaviors, you're meeting with other physicians, you're meeting with the whole team to get you ready. Not only do you have to be physically ready, but you have to be mentally ready. And then once we get you to surgery, we will support you for the journey thereafter.
So I really like how you talk about how you address the physical and the mental aspect of it. Those two pieces working together help you make an informed decision. So now I'm equipped with this information, I'm interested in surgery. What's my next step?
The next step is to go online at DMC and watch the online seminar for bariatric surgery. When you watch that seminar, you'll be connected with a bariatric surgeon at DMC for a consultation, and that's the start of the journey.
Dr. Somerset, thank you so much for being here today to educate us on this topic. It was so helpful.
Yeah, thank you for having me.
Thank you for joining us. If you need more information about bariatric surgery or want to know more about the program at the DMC and to make an appointment, simply go to dmc.org/weight loss.